How is the urinary bladder structured? Have you ever wondered how the urinary bladder is built? This remarkable organ plays a crucial role in our urinary system. The urinary bladder is a hollow, muscular, sac-like structure located in the pelvic cavity. Its main job is to temporarily store urine before it is expelled from the body. The bladder is designed to stretch and expand while keeping its lining intact, allowing it to hold varying amounts of urine. The bladder has four main parts. First, there is the apex, which is the pointed front part. It connects to the median umbilical ligament, a remnant from our early development. Next is the fundus or base, which is the back part of the bladder. This area contains the trigone, a smooth triangular region defined by the openings of the two ureters and the internal urethral orifice. The body is the main section of the bladder that collects and holds urine. Finally, the neck is the narrow bottom part that connects to the urethra. This area is surrounded by the internal urethral sphincter, which helps control the flow of urine. When the bladder is empty, it has a pear shape and sits entirely within the pelvic cavity. As it fills with urine, it expands upward into the abdominal cavity, taking on a more oval shape. The bladder wall consists of several layers. The innermost layer is called the mucosa, made of transitional epithelium. This specialized tissue can stretch to accommodate different volumes of urine without being damaged. The trigone area has a smooth mucosa that is distinct from the rest of the bladder. Beneath the mucosa is the submucosa, a supportive layer of connective tissue. The muscularis, also known as the detrusor muscle, is a thick layer of smooth muscle fibers arranged in various directions. This muscle contracts to help expel urine during urination. The outermost layer is called the adventitia or serosa, which anchors the bladder to surrounding structures. The top surface is covered by the peritoneum, forming a serosa. Blood supply to the bladder mainly comes from the superior and inferior vesical arteries, with some differences based on sex. The bladder is controlled by both sympathetic and parasympathetic nerves, which help manage its filling and emptying. From a bladder health perspective, the transitional epithelium lining is significant because most bladder cancers start from these urothelial cells. The bladder's ability to stretch and its muscular control are vital for normal urinary function. Any issues in these areas can affect bladder health. In summary, the urinary bladder is a dynamic organ with a complex structure designed for safe urine storage and controlled releases. Its specific anatomical regions and specialized tissues are essential for its functions and overall health. Always consult a healthcare professional for personalized advice regarding bladder health.